Welcome back to the lecture series on periodontics. In today's lecture, we are going to discuss about the microscopic features of gingiva, focusing first on the gingival epithelium. So this topic is a critical foundation for understanding gingival structure and function, and I will guide you step by step to make this concept easy to grasp. So when we examine the gingiva under a microscope, we observe two main components, gingival epithelium and gingival connective tissue. This is the gingival epithelium and this is the gingival connective tissue. So let us first explore the gingival epithelium, its structure, functions and process in detail. So gingival epithelium is a stratified squamous epithelium, meaning its cells are arranged in multiple layers. So in stratified squamous epithelium, the cells are arranged in multiple layers. So morphologically, gingiva is divided into three types based on the structure and function. So first is the oral or the outer epithelium. So this is the oral or the outer epithelium. And second is the sulcular epithelium, which is lining the gingival sulcus. And third is the junctional epithelium. This is the junctional epithelium. Each of these plays a significant role in protecting and maintaining the gingival architecture. So, let us understand about the functions of gingival epithelium. Gingival epithelium is having four main functions. So, first is mechanical protection. So gingiva is offering the mechanical protection by shielding the underlying structures from the physical trauma. Second is chemical protection. Gingiva is offering the chemical protection by resisting the chemical irritants. So it will not allow the chemical irritants to enter into the underlying tissues. Third is gingiva is acting like a microbial barrier. So gingiva is inhibiting the microorganisms to enter into the deeper structures. It is not allowing the microorganisms to enter into the deeper structures. And next is gingiva is preventing the water loss. So gingival epithelial tissue is helping to maintain the tissue hydration and thereby preventing the water loss. So these functions are made possible by the specialized cells and also the processes within the gingival epithelium. So gingival epithelium is having two main cell types. First is keratinocytes and non-keratinocytes. So keratinocytes are the predominant cells in the gingiva, and these cells are responsible for the keratinization and also for structural integrity. Second is non-keratinocytes. Non-keratinocytes are also known as clear cells. There are three different types of non-keratinocytes in the gingival epithelium. First is Langerhans cells. Next is Merkel cells. And third is melanocytes. Langerhans cells are doing immune surveillance. Merkel cells are providing the sensory function. And melanocytes are responsible for the pigment production. Now let us focus on the keratinocytes and the process of keratinization, which is vital for the epithelial function. So let us understand about the proliferation of the keratinocytes first. Keratinocytes are proliferating primarily in the basal layers. So this is a keratinocyte and this is the stratum basal, stratum spinosum, stratum granulosum and stratum corneum. So gingival epithelium is organized into four different layers: stratum basal, stratum spinosum, stratum granulosum, and stratum corneum. Now, proliferation of the keratinocytes is usually happening in the basal layer and less frequently in the suprabasal layer. So, this proliferation is driven by the process known as mitosis, where new cells are produced. Very few cells in the basal cell layer are retaining the proliferative capacity, and remaining cells or large number of the cells, they start moving towards the surface. So when the cells are moving towards the surface layer, they are undergoing the process known as differentiation. If you would like more details about the mitosis and the structure of stratified squamous epithelium, you can refer to my previous video linked in the description. So next, let us understand about the differentiation of keratinocytes. As we have already discussed, as the keratinocytes migrate from the basal layer towards the surface, they are undergoing the process known as differentiation. So this is involving a series of differentiation is involving the series of the morphological and the biochemical changes within the cells, and they are collectively known as keratinization. The key changes during the differentiation are progressive flattening of the cell. In the basal layer, the cells are usually cuboidal in shape, but as they move from the basal layer towards the surface, you can see the cell is getting flattened. So you can see during the differentiation there is progressive flattening of the cells as they move up from the basal layer towards the surface layer. And second is there is increase in the number of tonofilaments. So as the cells are moving up from the basal layer, you can see the tonofilament number is getting increased within the cells. So these tonofilaments are the structural filaments which are providing the strength to the epithelium. Third is the formation of the keratohyaline granules. So this is the stratum granulosum layer. So you can see the appearance of the keratohyaline granules in the stratum granulosum layer. As the cells are migrating towards the surface, there is also increase in the desmosomal junctions in between the cells. So this increase in the intercellular connections will enhance the resistance towards the damage. So when you look at the topmost layer, which is known as a surface layer or the stratum corneum, so when you look at this layer, you find that there is no nucleus and no organelles present in this layer. So this layer is protective in nature. And apart from that, this layer is also preventing the water loss. So why does it prevent water loss? Because it is having a cell envelope. So this layer is having a cell envelope. This cell envelope is rich in lipids, which is preventing the water loss. And this layer is also enhancing the barrier function. These changes culminate in the formation of fully differentiated corneocyte. And they are the end products of the keratinization.
If you found this video helpful, hit the bell icon below and subscribe to my channel, and stay tuned to Tooth Fairy Tales for more dental videos.